So our next speaker, who is live, I'm very glad to say, is Alison. She will be live as well to ask questions or answer them, so I'll field those. So please do use the chat box so that I can field any questions towards the end, and that's really vital for all our speakers. So please do make sure you do that. So I have a short bio as well about Alison. So she's Dr. Alys Einion Waller. She's an Associate Professor of Midwifery and Reproductive Health at Swansea University. She teaches midwifery, maternity care, research methods, gender, equality, nursing, healthcare, and social aspects of health. She's an equalities activist and a researcher in the fields of midwifery, motherhood, narrative, gender, equalities, and reproduction. Prolific writer, she has a PhD and an MA in creative writing, as well as an MA in professional development. Alongside her teaching and professional qualifications, she is the author of 2 novels published by Hono Press, Inshallah, no doubt you'll tell me how I pronounce that, and Ash. In 2019, she won the Mary Williams Award for promoting gender equality at Swansea University, and was shortlisted for the Pink News Public Sector Award for her work advancing LGBT and equality at the university. She's a Fellow of the Royal College of Midwives. She's also the founder of Centred Birth Hypnobirthing. Her book, Bearing the Weight of the World, Exploring Maternal Embodiment, was published by Demeter Press in 2018. So the screen, as we all say, is hers. Please use that chat box and we listen to Alison. Thank you.
Hi everybody, I'm just going to start my presentation. Hopefully this works and that you can all see it. Hurrah. So welcome to my talk, and it's really great to be here and sharing this with you. So today I'm talking about research that I carried out last year on our centered birth hypnobirthing classes, and I'm here presenting the research on behalf of my colleague and co-researcher Maeve Reagan, who also works she works in Birmingham Women's Hospital at the moment. So first of all, I'd like to make some acknowledgements about my presentation. We acknowledge that women and people of all genders and sexualities may give birth. However, in this study, all of the participants self-identified as women, so the terms woman and women and mothers are often used to refer to them. We also acknowledge that we, as midwives, speak from a position of inherited privilege relating to colonialized systems of knowledge, power, and oppression, and it's our aim to use our position where possible to give voice and space to unheard voices of oppressed peoples. And hopefully this presentation has been designed for ease of visibility and access for people with diverse needs. So I want to start with a quote from Lesley Page, one of my midwifery icons, because this really sums up where we came from when we started to create centered birth hypnobirthing. That childbirth is the birth of something. It's not just the birth of a baby. It's not just a mechanistic function. Childbirth is the birth of the relationship within a family, between the mother and her baby, the father, the other parent. It's the creation of a new family. It's a critical time for formation of secure attachments, for bonds of love that tie families together and lay firm foundations in life. And this reminds us, this is from the book on spirituality in childbirth. This reminds us of how important this time is, how sacred and how special, and how we should never forget that, regardless of the context that we're working in, regardless of the current situation, we should never forget just how important birth is. So we started our research from an awareness of the impact of the COVID-19 pandemic on birthing people. We realized that there were radical changes to the provision of care and that choices were starting to decrease. And as we had been working, well, as I had been working in Swansea University, providing hypnobirthing classes in a physical one-to-one format, I was very aware during that time of how people exercised their right to choose and how they gained knowledge to make choices. But it seems to me that following years of austerity, the impact of this virus has been really to restrict services in a way that potentially is not serving birthing people and is affecting how they prepare for birthing. So quite often this means reducing options for place of birth, excluding additional birth support, and partners not being able to access antenatal appointments and scans. There's also been wide-scale cancelling of antenatal education programmes, and these are all understandable. Within the resources, with the impact on midwifery, these are all understandable changes. But these restrictions are having an impact on parents and parents-to-be, and there may be long-term harm associated with this, particularly on the physical and psychological health of families. And it made me think of whether these restrictions actually reflect our over-medicalised and patriarchal models of care, and reflect further the chronic poor resourcing that makes these decisions necessary, which can actually be a threat to women and birthing people's human rights. So a little bit of background. So we started centred births a few years ago at Swansea University. We have a Health and Wellbeing Academy, which is run by our College of Human and Health Sciences. And some of the midwife lecturers there, myself included, trained in hypnobirthing, and I started centred birth as a form of hypnobirthing that was based on evidence. So as a midwife, I've been a midwife 23 years this year, and prior to coming into academia, I worked in an acute midwifery setting on a labour ward. I was a delivery suite midwife. As a midwife, I felt that I had a lot to offer in providing hypnobirthing classes that were accessible to everybody. So the idea was that we would focus on evidence-based information supporting the physiology of birth, emphasising the rights of women and birthing people to make autonomous and informed choices about all aspects of pregnancy and maternity care, and also emphasising the power and the authority of the birthing woman or person and their partner. So the model that I developed was based on my own training in hypnobirthing, but then from further research into hypnosis and into the evidence base for various kinds of supportive approaches to women gaining their own autonomy and feeling confident and prepared to birth. And this includes positive framing, the use of language, particularly positive language, using deep relaxation and hypnosis techniques, and also relevant information that supports women and parents' knowledge and understanding of birth physiology. We all know how important birth physiology and a knowledge of how birth works is to people who are preparing to give birth. And we all know that enhancing the power of the body to give birth itself is part of what we do as midwives, but it's also something that women and partners and parents can do. There are many things to do to enhance that physiology. So we wanted to share all of those techniques. So they might include, we do sessions on upright and mobile birth, we do sessions on informed decision making, we talk about complementary therapies and their safe use, we talk about touch and massage, music, the use of affirmations, the use of deep relaxation hypnosis scripts, short and long ones, and self-hypnosis techniques, and as well as providing antenatal education about birth and about choices. So prior to the pandemic, we were offering group classes and one-to-one classes, and initially the group classes were free, but then we had to move to having them paid. So we were charging £75 per couple to engage in the group classes. One-to-one classes were a completely different matter, and could it be anything up to £250 for single couples. When the pandemic hit, we had a class ready to start a week later when the first lockdown hit in March. And we immediately moved the classes into an online format. So I realised that during this time, it became very apparent from my networks that antenatal classes were going to stop, and that there would be no antenatal classes available to most people unless they paid for them. So I got agreement from the university that I could offer the classes for free online. And we did the best that we could to adapt them to an online format. And the first class went live at the end of March in 2020. And they've been running ever since, right up to this month. So what I'd like to emphasize about these classes is that what is unique about centred birth is we consistently discuss the use of birthing knowledge and hypnobirthing techniques for all kinds of birth. We emphasize the medical team as a safety net and how valuable that is. We reinforce that the woman or birthing person is central to the birthing experience, but that it is centred birth with a safety net. We've had over 250 people attend the classes since the first lockdown, which is quite a lot of people and quite a lot of impact. And we've also had student midwives, maternity care students as observers, and a PhD researcher has been there observing as well. We've had couples and single people attending the class. And they've evolved. They've had to evolve during the pandemic. We had to learn on the job, as it were, to understand what would work and what wouldn't work in an online format. There are limitations and challenges of providing something like this virtually, and it is not the same as the personal and interpersonal interactions that you get in a real world setting. But we had to make the most of the medium that we could and do our best and provide something, and hopefully provide something that would be of value to the birthing people. So we set out to carry out some research to see if we were actually having any effect. We were we having any effect? We also wanted to better understand the lived experience and thoughts and fears of our class attendees. We wanted to inform our practice from this, but we also wanted to centre the voices of mothers and fathers and parents during this time of global emergency so that we could reflect that in the ways that we worked with future cohorts of clients. So what we did was a mixed methods online survey. This was an anonymous survey. It was comprised mostly of qualitative questions. There were a few demographic questions in there, such as gender and gestation, and whether the person was still pregnant at the time of filling in the questionnaire, whether they'd had their baby. But most of the questions were open-ended, qualitative questions, focusing specifically on their experience of the classes, the fears for childbirth before the pandemic and their current fears, and the impact of COVID-19 on the experience of preparing for birth. We thought that this would help us to share information of what it's like to be pregnant and preparing for birth during a pandemic, and also help us to make our classes much more sensitive and much more applicable to a diverse range of people. And what we noticed was, even though our first classes were very locally focused, over the last nearly a year, we've actually had international people attending. The spread has been much, much wider. So the way that we managed it was that all class attendees who come to the classes, they complete a registration form. And on that, there is a question asking them whether they'd be willing to be contacted in the future with in relation to research. So it's not asking them to be part of research, just are we allowed to contact you? So only those who indicated in the positive were contacted during the study period. And this was carried out in July and August 2020. So we've been running the classes since March, and we started collecting data in July. There were 101 people contacted, and I had 25 responses, which is just under 25% response rate. And for a qualitative questionnaire, this is absolutely fine. And the data that came in was actually really rich, and I was really pleased with the depth and quality of the data. So we analysed these qualitative responses thematically, and that's what I'm talking about today, the qualitative responses. And this research was subject to ethical review by our College of Human Health Sciences Research Ethics Committee. So we analysed the data. So what I did was I analysed the data in NVivo. NVivo makes it really easy to analyse qualitative data and to organise your themes, to write memos as you're going along, and I really love using it. And I analysed it using the Braun and Clark method, because that's a really good stepwise approach. I carried out the initial thematic analysis, then I shared the data. Once it was all anonymous anyway, there was no identifying data. But then I shared the data, and Maeve, my colleague, confirmed the themes, added her own interpretation, and then we reviewed our initial categories and agreed our final categories. The thematic findings are grouped into 3 overall areas. This was preparation for birth. Obviously, we'd ask questions about this, so that was an understandable theme. Feeling cut off, and the impact of COVID-19. There were 14 sub-themes, which I'm not going to go into right here, but there were 14 sub-themes underneath those 3 main themes. And the cross-cutting themes that ran throughout all of the responses were fear and uncertainty, and knowledge is power. So through this, we noticed there were 3 main sets of themes, 3 main themes, but these cross-cutting themes seem to appear through all the data. And we couldn't really put them aside as themes on their own, because they link to every other theme in the data. So let's take a look at the first theme, preparation for birth. This was really helpful to us, because when you're doing something you've never done before, and when you're doing something that very few other people have done before, it's really important to know if you're actually having the effect that you wanted to have with your, with your hypnobirthing classes. So our study showed that people prior to the pandemic had a good degree of trust in the systems and institutions of birth. When they were preparing for birth before the pandemic, they'd anticipated that what kind of care they would get. And they felt then that when these were removed, people tended to go into a bit of a state of panic. So what I found was that quite a lot of people stated that because of that state of panic, they found out about my classes and signed up for them thinking, well, there's nothing else available. I really need something. I need contact. They also had basic expectations of giving birth in a hospital because it seemed to be the place that most parents felt was safest. What was interesting to note, though, was that when I was reflecting then on the experience of the classes, and it's a really interesting position to be in as an insider researcher, because I co-lead the classes with my colleague Maeve. And so you're an insider researcher, and that obviously introduces a certain degree of bias, which you have to acknowledge, but it also makes you reflect then further, because after this study, in the classes afterwards, we noticed a trend towards people saying they were planning a home birth when they hadn't done before. So that was another potential impact of the COVID-19 pandemic. So most participants in my study, that's 24 out of 25, stated that the classes made them feel more prepared for their birthing. And quite a lot of it was focusing on the idea of being calm and relaxed. So these are quotes from the data. It was very helpful and relaxing. And some were surprised, actually, because they hadn't intended to attend hypnobirthing classes. So one of the participants said, it's very informative. I originally thought hypnobirthing would be a bit out there for me, and it was good to see it backed up by the science. And that's an interesting statement, I think. Here's some more quotes from the data. So one participant said, I thought the classes were clearly evidence-based, sensible, and made sense. I feel really confident about what my body is capable of doing. And this point here, they liked the fact that the class wasn't against medical intervention when needed. We emphasize in these classes that every birth is a centered birth. And so every kind of birth can use these techniques, regardless of what medical intervention you might need. So this kind of flips on its head the idea that hypnobirthing is just for, very, very natural births. And also, they found explanations to be helpful, to feel more involved in birth as it feels quite far away and a bit unknown. People felt less nervous, and they also felt empowered. And that really made us feel like, yes, we are doing a good thing. It is worth this. It is worth the effort it takes to keep running these classes online. And we are actually having some of the effects we'd hoped to have, despite the limitations of the medium. But another theme was this one of feeling cut off. And this was one of the three main themes. And it was very, very clear that this was really affecting the women and parents. It was a theme of disconnection from other mothers and parents and from ready access to midwives. So you can see here from these quotes that the restrictions which were introduced really did impact on how people felt. I don't like attending medical appointments without my partner. I feel cut off from other mothers, and like my support network is far away. I'm worried my partner won't be able to be with me while I give birth, or baby will get sick. Some wanted to come to the classes because they felt this was a way to be with other parents, to connect with other parents, and to talk to them, given the fact that they couldn't go to any of the normal, usual places for peer support. And some felt really affected by being allowed to have only one birth partner. So the anticipated sources of support that they would have planned to have for their birthing had been removed, and it was apparent that this was affecting people. And I like this quote because she says, this is difficult because my mum and partner provide different types of support. And I feel this will be beneficial to help me to be relaxed. Especially when being stressed can have a huge impact on how I cope with labour and birth. So it brought home to us that we were working in a context where usually we work in hypnobirthing to try and reduce fear and stress and anxiety, but actually we're working with much higher levels of fear and anxiety, and that this feeling of being cut off was increasing that. And that people had quite a lot of negative emotions about being cut off from their family during the pregnancy. So here's one: sad that my family have missed out on my pregnancy. When we asked how parents felt the COVID-19 pandemic had affected their experience of preparing for birth, They were worried about the ways that their choices had been limited. Other things that they were worried about were, for example, lack of access to birthing pools at various periods of time during the pandemic, and wondering whether other less interventionist coping aids would be available to them. You know, simple questions about TENS machines, for example. It also exacerbated their fears and limited their choices quite significantly. So one mother said, the pandemic has allowed more stress and worries to creep in with regards to labour and birth. One said, a lot more anxious and feeling a lot more lonely. Another said, it made me very nervous and anxious, as well as very emotional about how it would impact my idea of a normal birth. And another said, COVID-19 has exacerbated the fears above. That's referring to her own fears she'd already identified. I'm now concerned it will be more difficult to access support from friends and family, healthcare professionals and other support groups that aren't currently running. So you can see that there has a very significant effect on how people are experiencing preparing for birth. And the cross-cutting theme of fear and uncertainty just was present throughout. And this was related to common fears, fears that have been introduced or made worse during the pandemic, but also there was some evidence of the effect attending the classes had on reducing or at least managing people's fear and uncertainty. So one woman said, it's made me more anxious about attending medical settings, and another worried about making the wrong choices. And this one in particular stays with me, this next quote. Being isolated and trapped, no support and no one available for advice. I feel more worried about the future. And I think that's really, really important. And we felt and still feel that if the classes provide a sense of connection and having someone available for advice, even for a few weeks, then we're achieving something really positive. But the impact on people's emotions is obviously clear from these quotes: feeling anxious and sad, being afraid of unnecessary intervention, and the fear of contracting the infection in hospital. When mother says she's reluctant to give birth and expose her baby to outside risk. So she's actually afraid to give birth because then her baby might catch the virus. So it's clear that fear and uncertainty has significantly increased. Here are some more quotes that give more detail about fear and uncertainty. One mother felt more worried about being alone and husband having to leave, and she's worried about having an induction on her own. Another said, as a first-time mother, it has shadowed the pregnancy. What should have been a happy and joyous part of our lives and should be spent with friends and family has dampened our experience. Being uncertain about the birth and if my partner was able to attend also made her more anxious. But predominantly, feeling prepared for many of the participants took some of the fear out of birth. The final cross-cutting theme was knowledge is power, and it seemed that having access to what parents deemed as relevant knowledge provided by a midwife was really linked to self-efficacy and empowerment. So understanding how the body would be changing at different stages of labour, being able to talk about things like birth plans, decision-making around the birth of the placenta and the breathing, important skin to skin. They didn't know about this before the classes. The classes' use of positive reinforcement helped them to think about their views on childbirth and help them to make decisions. And they definitely feel more prepared with this knowledge. Knowledge was linked to being more relaxed and more prepared and having more confidence. And confidence too that their husband or partner who would attend would have a good understanding. So here's some more quotes about knowledge is power and knowledge is power. And we've learned an awful lot from this. I feel that through these classes, we're actually managing to reach people and provide some of the things that they need to help them through what is a difficult situation. What was interesting, though, is the authoritative knowledge was really valued by these women. So in the second quote here, it was equally important for me as a nurse that the classes were run by someone who was clearly qualified to be teaching the classes. So I think that was a really interesting finding, that many of the participants did value the fact that these classes were provided by qualified midwives. And I love the last quote. The class has much wider impact. I thought I just learned about hypnobirthing, but it was so much wider than that. There are a couple of comments that they found really helpful. So they like me reminding them that bodies have grown their baby without conscious effort, and so they can birth their babies in the same way. And Maeve suggesting it was fine to stay at home as long as possible and just go into hospital for the final bit. So we can see that for some people, what we're doing is really effective. and is at least helping them to feel more prepared for birthing in a situation of extreme stress and anxiety. So the classes appear to have had a positive impact on parents' sense of preparation, helping to reframe birth as a positive experience despite the context. But fear and uncertainty, social isolation, and a lack of access to professional expertise has had a negative impact. The classes can't replace the peer bonding and relationship formation that would form part of in-person classes. But even with the acknowledged limitations of what we're doing, they found value in having a person-centered and rights-based learning experience, and they valued the techniques that we helped them to learn. But our classes cannot and will not remove the fear and uncertainty of giving birth during a pandemic. So the conclusions and implications of practice, to me, the voices of the mothers in this study speak clearly and poignantly to the isolation and lack of social contact they've experienced. And they missed the peer support in particular. And on that note, we have now gained a small amount of funding to carry out our Swansea University Outreach Online project, where we're creating an online parents support group, a new parents discussion group, which starts tomorrow. Access to midwives' knowledge was valued, particularly focusing on every birth being a centered birth. And the online classes was useful for most people. As I said, the majority of attendees had not planned to hypnobirth, and they found the classes useful anyway. But we do feel that we need to return to a social model of birth and reconsider the impact of these restrictions in service delivery on parents. We were left with some future questions. One of the things was we wanted to call into question the knowledge being shared. They valued our authoritative knowledge, but would these classes be an opportunity to decolonize midwifery and foreground diverse ways of knowledge? And how critical are we of how the knowledge we share might perpetuate a medicalized culture, even if we're well-intentioned? Are we actually adding to, within these restrictions, are we reinforcing a pervasive embedding of the risk discourse in maternity care? The issue of tolerance of uncertainty, this has always been an issue in midwifery, that parents are looking for certainty and concrete answers. How can we increase tolerance of uncertainty for parents and professionals? And also, how can we stop and reverse the dehumanization of birth during this global pandemic? So those are the questions I'm left with. There are my references. And I'd just like to say thank you very much for listening. This research will be published in this book here, Mothers and Mothering and COVID-19, which is currently at the printers and is due for release, and is published by Demeter Press. Thank you. Any questions?
Thank you very much, Alison. What a fantastic presentation. I've been enthralled listening. You have got some questions, and we've got a few moments, if that's okay, to answer these. This one's from Hayley. So thank you very much, Hayley. She said, have you found participation has increased or decreased since moving the course online?
Hugely increased. So usually we had a limitation in the space for classes, and it would only be local people. Since moving the course online, we can have anything up to 70 people in one class. Yeah. So whereas we'd limit the class before to 6 couples, maximum of 12 people. And we've also had to run the class much more often. So for example, we ran 2 classes in 1 month during April, May, because there was so much demand. So there's been a huge demand for classes.
Thank you. This is from Tasha. Do you think with the NHS stopping antenatal classes, this gives more opportunity to share a wider variety of non-biased, evidence-based information online with topics such as hypnobirthing and breastfeeding, so more time and more access to parents as they can do it from home?
I think that there's a real opportunity here for us to rethink how we prepare parents for their birthing and to really focus on diverse ways of sharing that information. But one of the things I've also noticed is that some NHS providers that I know, and only those I know within my networks, I can't talk about all of them, but some have actually moved to the same format. So during the pandemic, obviously they've taken time to provide similar information via the NHS. And that's been really great to see how they've diversified their content as well.
Great, thank you. You've got lots of messages. I'll get through them as quickly as I can. Lola, thank you. Unfortunately, the fear and anxiety caused by the pandemic has a knock-on effect on oxytocin levels and women going into labour naturally. We're already seeing this, it's more a statement, we're already seeing this in the decreasing birth rates at the birth centres that I work. That's very
Yeah, that is something we're aware of. I mean, it does seem when we have discussions with the parents, their fear and anxiety is much increased. And that's why we focus so much on using techniques to manage those feelings. We really focus on oxytocin as, you know, the thing that we want to aim for. And we try and, there's a range of techniques that we give to parents to try and enhance their oxytocin. And we do talk about ways of trying to stay relaxed and manage that fear. But you have to give space for people to express those fears as well, and acknowledge that they're real. You know, they are real fears, and we shouldn't just be brushing them aside saying, oh, well, just do a bit of breathing and you'll be okay. That's not right either. We have to really work dynamically with that.
You have got loads, so I'm afraid I'm only going to do one more, and the others will be forwarded to Alison. Please be reassured. This is from Kate. What I love most about these days, thank you for that comment, is learning about what others are doing to help women and birthing people. The question is, do you train HCPs? In other words, other professionals?
Yes, we do. In fact, at Swansea University, we have a centred birth practitioner course for anybody who wants to learn how to provide centred birth antenatal education. And that is open to anyone at all. You don't have to be a midwife to do that. It's a 10 credit level 6 module. I also teach, I present and share hypnobirthing across a whole range of different formats. And I've presented at Swansea Science Festival and at in different areas. So I'm trying to get it out there. I also teach across a lot of different programs in healthcare, in nursing and paramedic science and physician associate studies. So I always talk about it there and try and create this idea of a new model of, not a new model, it's an old model really, but of returning to the idea of birth as something that we are designed to do, and that there are techniques that will enhance that birth experience and the birth physiology.
Thank you very much. We've actually got a question from our next speaker, so that leads in beautifully. But please be reassured the other questions and comments and thanks will all be passed on. Thank you very much.
Thanks a lot.